Lip filler lumps and bumps, are they normal? What to do about them and how do you avoid them in the first place? On the show, I'm going to discuss the important things you need to know if you're a patient or a clinician about this particular topic. Firstly, lumps after a procedure are actually relatively common because lumps can be caused by the procedure itself. Simply putting a needle into the tissue can cause a small bruise or hematoma that causes a lump. That type of lump tends to get better on its own, and it tends to be tender when you touch it. So that's the way you can differentiate it. The other kind of lumps we want to be aware of are lumps that are caused by the filler itself. So that's just a lump caused by injection technique. So a lump of filler or a bolus of filler that the patient can either see or feel that bothers them is also an easy type of lump to solve, because if you think about it, it's just a lump of filler. You should be able to massage it until it softens and fades into the tissue. So this is a non-inflammatory lump, non-inflammatory lesion as we call them. It's a massageable lump, or it may go with time. So many procedures, there's a combination of swelling plus newly placed filler that hasn't integrated, and the cure for that can just be time. The next type of lump is lumps caused by inflammation, which could be infection or a reaction to the product. So these are different because they need a medical response. If you have a lump that grows over time, and it's particularly if it's asymmetrical and there's redness around it, it could be the start of an infection or an actual infection, or it could be a reaction which typically involves the rest of the lip also swelling up. But they can go very, very lumpy when the product is reacting with your immune system. So those are the core types of lumps that you may face as a clinician or a patient. And the next question is, how do we actually avoid them in the first place? So in terms of avoiding non-inflammatory lesions, those are basically just lumps of filler. The biggest thing you can do is just make sure that after you've done the procedure, you do a gentle check for any lumps or bumps that you can feel on that day. Because if you leave a large bolus of filler, it tends to attract moisture, and it tends to become firmer over the next few days. Whereas if you massage before the patient leaves, and I always say we smooth it, don't move it. So it's a gentle squeeze that respects the shape of the lip you're trying to create and gently integrates the filler into the lip tissue rather than just squashes it, then you should decrease the amount of follow-ups that come from these non-inflammatory lumps. In terms of avoiding inflammatory lesions, a lot of this is down to injection technique, trying to keep the lip area as clean as possible while you're injecting, not applying makeup, particularly makeup that's not sterile after the procedure. Anything that seals in a bug might be a problem. I also think you can decrease the risk a little bit by trying not to make as many entry points as often we end up doing. So try and reduce the number of entry points, because each entry point is a potential entry point for bacteria. It might also be worth doing procedures on days when you're not doing anything else, particularly dental procedures. The more bacteria enters the bloodstream around the patient's head, the more likely some of those bacteria may settle onto an area of filler, and then you end up with lumps and bumps that are caused by inflammation down to bacteria, which are the hardest type to treat. So depending on the type of lump that you are faced with, you can either give it more time if you think it's just to do with post-procedural swelling. You can massage it if you think it's to do with placement of filler or a large bolus that's distracting for the patient. Or you can get into treating the medical causes of lumps or bumps, which are infection and allergic reaction. Once you can deal with all of those, you should have a sequence in which you can apply intervention sensibly, doing the minimal intervention necessary, and restore most patients back to a happy state within the first or second visit. But you will find the more you think about this topic and the more you improve your injection technique, post-procedure massage, that the number of lumps you get should reduce over time. Although they'll never get to zero, it's a pretty common side effect after lip filler. So assuming you've now done all the light touch interventions with massage and time, of course you have got the final sledgehammer, which is you can dissolve all the lumps with hyaluronidase. Now, it's a good idea to try not to do this until you know that that's your best option. So I definitely would not go straight to dissolving on day 2 or 3 after a procedure with a patient who just hates having a lump. You must give a lot of these time, because you get lumps just from hematomas and swelling, and there's no guarantee that reversing it will get rid of it. You might just cause a different type of lump. So we always work our way through the interventions with light touch until you're doing something more drastic, but because you've gone through a process. Okay, so I hope that's helped you understand a bit more about how to deal with this very common side effect after a lip procedure. If you also like to learn more about anatomy and safety generally, then I have a couple of very interesting projects that are about to emerge, and I recommend you sign up in the links down below.